Which of the following may cause the abnormalities of the QRS axis shown on this ECG? A. Inferior myocardial infarction. B. Pulmonary embolism. C. Anterolateral myocardial infarction. D. Right ventricular hemiblock. E. Chronic lung disease. And the answer, according to this ECG, will be inferior myocardial infarction. And we will explain here why we choose the inferior myocardial infarction. Explanation. The first step is to recognize that there is left axis deviation on this ECG. Okay? The easiest method to recognize this is to first find the lead that smallest or equiphasic deflection. And in this case, it would be lead AVR with the smallest or equiphasic deflection. It will be AVR. Okay? And second, we should look for the leads which are at right angles to the first lead we chosen. This would be lead 3 here, and it would be lead 3 in the right angle with AVR. It will be lead 3, and lead 3 is negative here. In this ECG, we are seeing that lead 3 is negative. And third, look at the net deflection at the second lead, and in this ECG we choose lead 3. Since lead 3 has a negative net deflection, this is a left axis deviation. This can be confirmed by looking at lead AVL, where we can see a positive net deflection. For example, here, and lead 3 here we are seeing negative deflection. If this is minus 30, and we will see here it will be minus 60, and it's net negative deflection. Okay, to recap, first we should lead with smallest deflection is AVR. Our lead with smallest deflection is AVR, and lead at right angles to AVR is lead 3, and net deflection in lead 3 is negative. Thus, as we explained, axis is minus 60, which falls under left axis deviation, and it's here 60. It will fall under left axis deviation, minus 60 here. Okay? And a common cause of left axis deviation is inferior myocardial infarction. And note, we should remember that this question is not asking if this is an inferior myocardial infarction. Hence, the ECG does not show the typical ST elevation in leads 2, 3, and AVF. But this question is asking what abnormalities could represent a left axis deviation, or which inferior myocardial infarction is the only option. And here are some causes of axis deviation. Common causes of left axis deviation, or LAD. First, left ventricular hypertrophy or AVH, left anterior fascicular block or hemiblock, and inferior myocardial infarction. And less common causes of left axis deviation is obesity and Wolff-Parkinson-White syndrome. And common cause of right axis deviation: right ventricular hypertrophy, thin, tall person, chronic lung disease, pulmonary embolism, left posterior hemiblock, and lateral myocardial infarction. Lateral wall of the left ventricle is supplied by left anterior descending. Infarction here would cause an axis deviation away from the site of infarction. And some causes of extreme right axis deviation, or also called known as no man's land or northwest axis. The common causes are congenital heart disease and left ventricular aneurysm. Here, completely against all normal electrical axis, which would be minus 30 to 90 degree here, to 90 degree between AVL and AVF, and here from 180 to minus 90 we have extreme axis deviation or no man's land. As we said, the common causes are congenital heart disease and left ventricular aneurysm.